Heart disease is a leading cause of death here in the US, and since February is Heart Health Month, we thought we'd get some practical advice on ways to keep your heart healthy. Joining us now is Dr. Maulik Shah. Dr. Shah, thank you so much for being with us.
Thank you so much for having me this morning. I appreciate it.
First off, are you finding that people are neglecting their heart health during the pandemic?
Yes, unfortunately we are. Obviously, it's been a stressful time for everyone. In fact, there have been some studies that have suggested that about 40% of people have not gone in to see their doctors for their preventive wellness stuff. And about 20% of people, even when they're having something really acutely wrong, like having chest pain, are avoiding going to the hospital or to the emergency room. And the problem with that is that sometimes it can have some devastating consequences in that if you don't seek out medical attention immediately, if you're having something like a heart attack, then the impact can be long lasting and permanent.
Dr. Shah, what do you say to people who may be neglecting their heart health right now?
I know all of us are apprehensive in this era of COVID and the infections that are going on to go to a hospital or a doctor's office. But the reality is that there's a lot of options. First of all, most physician offices are taking great precautions to make sure that they're a COVID safe environment. And then equally important, I think this COVID world has actually pushed us to become more avant-garde with advanced technologies such as telehealth to make sure that we can actually see patients and connect with them even without being in the same office room with them. And with telehealth, we're able to at least connect with the patient and make sure that they're not having any symptoms, that they don't need significant tests, and that we can also make sure if there are any adjustments that need to be made in their medications, we can do that while seeing them sort of virtually.
Now, let's talk about overall heart health. What are some things we should be doing to prevent heart disease?
But what we've learned is that more than 50% of all heart disease could have been prevented by just being proactive about your health. And what that means is everyone needs to know their numbers. So everyone needs to focus on their blood pressure, their cholesterol, their sugar levels, their waist size. And just by doing those things, you can really prevent a lot of heart disease. So for instance, high blood pressure. For every 20 points, your number is above 120, your lifetime risk for having a stroke or a heart attack goes up by about 33%, or risk for dying goes up by about 20%. So even if you could impact that small number, that blood pressure number, you can really prevent heart disease in a big way. And similar things are found by lowering your cholesterol, lowering your blood sugars, figuring out your waist circumference, and making sure your pant size isn't getting too big. If you know those simple things, those simple numbers, and focus on that, you can really prevent a lot of the devastating consequences of heart disease.
Dr. Shah, are women equally at risk for heart disease?
Great question. I think all of us have sort of a vision of sort of the Hollywood heart attack. A guy who's in his 50s or 60s, a little bit overweight, who comes in clutching his chest. And that's what we've always been thinking about as being somebody who has heart disease. But the reality is that sometimes it's not that person. And unfortunately, heart disease does impact women just as much as men. In fact, heart disease is the number one killer of women in the United States in most years. And the number of people who are women in the United States who die of heart disease is equal to or more than all forms of cancer combined for women, including breast cancer. So it's a big deal, and it's really important that we push our wives, our daughters, and our moms to get treated and get evaluated sooner rather than later so that we avoid any long-lasting consequences of heart disease.
Now, Dr. Shah, are there any indicators that someone may have heart issues?
Yes. So, when somebody comes in and we're suspicious about heart disease, there's, again, two things that we look at. One is their risk profile, meaning, hey, do they have high blood pressure? Do they have high cholesterol? Are they diabetic? Are they not exercising? So we look at that risk profile and we say, hey, this person does have a lot of risk. My suspicion is even higher for them potentially having heart disease. And then the second part is that when we think about people with symptoms. So again, the same things that worry us the most for when people are presenting in the emergency room are the same thing we think about in our offices, meaning if people are having chest tightness, shortness of breath with exertion, shortness of breath, exertional fatigue, those are the things that we think about really that could potentially be a sign that somebody is having heart disease or is at risk of having sort of occult heart disease.
Dr. Shah, thank you so much for being with us. This is such great advice. If you'd like more information, head over to Honor Health's website.